The absolute great pleasure to introduce Helen Brown, Dr. Helen Brown. Helen's going to talk about why our health rests in the hands of climate change action. And you can read what's on the screen, but the bits you don't know is that Helen and I actually shared an office at Curtin University many, many years ago now. But we were doing work on the National Ambient Air Quality Standards for the Department of Health, Federal Department of Health. And Helen did lots of other things as well, but you know, I really respected her from that day on, because she was just really in the space of just making safe workplaces, health and safety with regards to the environment, and she's just grown and grown and grown from those early years. So I don't want to steal her thunder, so you just go for it. I'm going to stop the share here so that you can share your screen, Helen.
Great, thanks very much for the introduction, Carol, and it's lovely to see everyone, especially from all corners of the globe. And I guess that's relevant for my talk, because I've really tried to give some different examples from different areas around the world in terms of how climate will be affecting our health. So I'll just start the share. So am I right there, Carol?
Yep, you're fine.
Great. Okay, from beginning. So the title of the talk, as Carol mentioned, is Why Our Health Rests in the Hands of Climate Change Action. This is an area I've been working in for a very long time now, but it's often surprising to me that people often don't actually think about climate change as a health issue. They see it as more of an environmental issue. So hopefully this talk is going to demonstrate the links between climate and health, and why our action is so, in this area, is so important. So this first slide is looking just a snapshot about the impact of climate change on low-lying islands and also coastal areas. I put this up first because it's probably the areas in the world that are at most threat. I mean, their very existence is under threat. I was reading the other day that maybe by between 2060 and 2080, the Maldives will have disappeared, which is obviously a tragic consequence for anyone living there. But also as the sea level increases, it increases flooding, it increases the intrusion of salt water into wells. That has impacts on their clean water, and as I mentioned, potentially forced relocation. As Carol mentioned in the intro, I've done a lot of work in Southeast Asia, particularly around the Mekong region, and this is an example from Laos, where I'm working now. So Laos is affected, like many places, by climate change in multiple ways. They've recorded record floods, droughts and landslides, and this is an image of a small boy near Vientiane, the capital. And obviously, when drought hits, we all know it impacts on our ability to produce food. Obviously, water scarcity is a major issue. And importantly, for the people living in those areas, also affects their ability to earn an income. Extreme heat is the next example, and I think it's a very timely example for Perth, that has smashed our record in terms of heat waves this year, with very early heat waves happening in December. The graph with the white curve labelled normal is what we would expect ordinarily with temperatures. And the graph is actually an example from the Northern Hemisphere, again demonstrating that this is happening everywhere. And the health impacts of climate change really happen at the two extreme ends of this normal curve. When we're in the middle, our health is generally pretty good. But the shift to the right, which is shown there, is from 2004 to 14. So we are moving into what we call kind of uncharted territory experiencing more extreme heat than we've ever experienced before, but also more extreme temperatures. So it's not just more heat waves, the temperatures are actually hotter. In terms of the health effects, there's a wide range listed there. I'm not going to go through all of them, but heat waves are often referred to as the silent killer, because even though they have resulted in more deaths in Australia than all of the other natural hazards combined, so fires, floods, cyclones, etc., they're often not reported. So hence the name, the silent killer. Just a couple of the impacts here, things like potential destruction of infrastructure. Many of us in Perth on Boxing Day, which had 44 degrees, experienced power cuts. And obviously that has significant flow-on effects to health. In Australia, but obviously again, not just limited to Australia, California, all across Europe, we've been seeing headlines about the unprecedented fires that are occurring as a result of a drying climate, as a result of less rainfall. And whilst some of our politicians may not be willing to contribute this increase in not just fires, but floods, droughts and heat waves to climate change, there is clear and widely accepted evidence that climate change is already increasing both the intensity and frequency of extreme events around the world. So in other words, this isn't some kind of theoretical exercise about what will happen or a future issue. This is an issue that is relevant now and is happening to people and communities all around the world. And of course, that's a picture of the Great Barrier Reef, one of the natural wonders of the world, which is under significant threat from climate change. So those impacts that I've talked about are really these impacts here on the left, what we call the direct effects from really the extreme events of climate change. But what we also need to be mindful of is there's also this column of red effects, which we call the indirect effects, which are probably going to have even more of an impact on our health. And then a recognition that not all people will be affected in the same way. And that's really where that green column comes in. Things like age and gender, your health status, your socioeconomic status, where you live, etc. So I'm just going to run through a few of those examples now of those indirect effects and who may be more affected. So I'll start with water quality. So everyone knows that the water is absolutely essential for life, and this is a document from WHO, Safer Water, Better Health, that indicated that inadequate, what we call water, sanitation and hygiene, which is referred to as WASH, is responsible for 3.3% of deaths every year. So about 2 million deaths per year. And the burden of that is primarily with children under 5, where 13% of all deaths are linked to inadequate water and sanitation. So that's a given, we know that. But what does climate change have to do with that? It's pretty apparent. When we have more extreme events such as flooding and extreme precipitation, that leads to significant contamination of water supply. So overflow of sewerage systems, contamination from agricultural lands, etc. And on the other hand, we have things like drought and extreme temperature, which in some areas is also resulting in increases in water scarcity. So all of those issues affect every element of WASH, both drinking water, water for sanitation, and water for hygiene. And so, of course, that's linked to diseases like cholera, incidents of diarrhea, but also strongly linked to things like poverty and education, hunger, and gender inequality. So as shown by the image at the bottom, of course, women and young girls bear the burden of collecting water. And when that burden increases, opportunities for things like education tend to suffer. Another gender issue with respect to WASH is obviously maternal and neonatal health. And this very recent report from WHO indicated that, in fact, the second highest priority after respectful and dignified care for women was WASH. And that the data indicates that infections from poor WASH is responsible for 26% of neonatal deaths and 11% of maternal mortality. It's more than 1 million deaths every year from inadequate WASH. And that will be affected by climate change. So one of the biggest pushes now with WHO is the development of what we call climate resilient healthcare facilities. So in this next slide, I put in a few examples of some of the focus on closing the gender gap. And so it's referred to as a gender action plan. It's being taken on board by the UNFCCC, and there's organisations around the world looking at not just WASH and climate change, but all aspects of climate change with respect to gender. And that's obviously not just because women are often more vulnerable, but often because women hold the key to action in this area. Women often hold the key to developing adaptation strategies in local communities and driving change. So unless this gap is addressed, action on climate change will certainly be nowhere near as effective. So that's examples of water. I'll move on to the other thing we really need in life in terms of health, and that's air quality. So climate change affects air quality in a number of ways, obviously through bushfire emissions. So the image on the right is of Sydney, looking at the air quality before and after the fires. Now that type of poor air quality was experienced for most of the summer months. And in fact, the fires of 2019, 2020 commenced in August, which is still winter in Australia. So air quality issues are a major impact of climate change, but not just through bushfires. A drier climate means more dust, more particulates. Hotter temperatures mean there's more formation of what we call ground level ozone that we breathe in, which is very bad for our health. And there's also evidence that climate change will also change pollen patterns, which will affect things like asthma. And given some 3.3 million people die around the globe every year from air quality, it's really a significant issue. So from water and air, what else do we need to survive and have good health? It's obviously food. So I've gone to some more examples here from Australia. The map there of Australia is just taken from the 1 year, but the projections are very similar. And that's for very much a drying climate over most of Australia, but some areas also experiencing floods. The southwest of WA, interestingly, has been identified by the IPCC, the International Panel on Climate Change, as well as the Murray-Darling Basin, as being particularly vulnerable to reduced rainfall. We often make the international reports. This has huge impacts on all of us, but particularly rural communities. You can see there are water restrictions that we don't necessarily experience in the cities as much. And many of these towns are now moving towards what we call day zero, where they actually completely run out of water and need to have water trucked in. And this is an image of a man who had to dig up thousands of citrus trees simply because there wasn't enough water. And as he says there, 8 years of his life gone in a single day, heartbreaking. Also that very confronting image on the bottom right-hand side, which was from a large number of cattle, estimates of 500 million cattle that were actually severely drought affected. but then drowned in the floodwaters. So these are all things that are happening now. It's not just limited to the agricultural sector. Obviously, there's a whole entire food chain. Climate change may well affect things like pests and fungal infections and the rate of weed growth. Impact on pollinators such as bees is also something that will be affected by climate change. Rising CO2 levels has been shown to change the nutritional content of our crops. And I think all of us are very familiar with the concept that food spoilage and foodborne diseases increases with higher temperatures and obviously with heat waves. The distribution of food is also greatly affected by extreme events, and obviously we've experienced this recently in WA, but also I believe that photo is from the Alice Springs, and that's from the floods that have been occurring in South Australia. And so that really affects our food insecurity, and the impact of that really depends on where you live. But I just wanted to talk a little bit about food insecurity and malnutrition. So food insecurity is really at a point where there's enough of a lack of access to safe and nutritious food that it will affect normal growth and development and have lifelong effects. So we're just experiencing temporary shortages at the moment, but of course in other parts of the world they're much longer term effects. And this is affected not just by climate change, but by, as with a lot of the other issues, environmental degradation and increases in population. And the vulnerable groups, again, women are vulnerable, particularly pregnant women. There's an increased risk of mortality, low birth weights, and physical and cognitive disorders. Again, children under 5 are particularly vulnerable, resulting in food insecurity, resulting in stunting and irreversible lifelong effects. And I must admit, I was quite shocked when I started doing the work in Laos to read the statistics that 1/3 of children in Laos under the age of 5 are stunted from food insecurity. And reading a figure yesterday, 1 in 5 or 20% of children under the age of 5 globally are stunted. Obviously, farmers and rural communities, because of their dependence on making a livelihood, are vulnerable, as are poor households. So in terms of the extent of that problem, I wanted to put up this graph, which is from the Food and Agricultural Authority. The red graph, the red line is the percentage of people who are severely food insecure in Southeast Asia. 10%, or 65.8 million people. And the quote on the right, which you can read for yourselves, is just indicating how climate change, climate variability, and climate extremes is affecting that and exacerbating the other pressures that lead to food insecurity and malnutrition. The last, I think, impact I wanted to talk about, I'll just mention briefly, was vector-borne diseases. So we've talked about the effect on potential effect on pollinators, but other insects and other vectors that spread diseases are obviously affected by the climate in which they live, the temperature, the rainfall. The relationship is quite a complex one, and the modelling is also complex. It essentially depends on the vector, it depends on the extent of climate change. But there's a lot of modelling that has suggested that diseases such as dengue and malaria that are responsible for many deaths and ill health around the world may expand into new areas as temperatures change. So that's really just a little bit of a snapshot on how so many things in our life are connected to climate. And I think sometimes we forget that, particularly when we're living in cities. So in terms of who is at risk of climate change, this is an infographic from WHO. It is everyone and everywhere, but not equally. Climate change is certainly a risk multiplier, and particularly for groups who are already vulnerable in many ways, whether it's in terms of health, economics, or a range of other things. So some of the examples there are those living in poverty, women and children. And obviously children are the most vulnerable to climate change because they are actually being born now into, for their whole lifetime, they will be in an era of climate change. So they're definitely more vulnerable. And obviously countries and individuals and communities that don't have the capacity to help. So don't have the capacity to adapt. So in terms of what we want to be doing about this, it's actually on paper and intuitively relatively simple. We should be mitigating. In other words, we should be reducing the amount of greenhouse gas emissions to make the problem, lessen the problem. And then we need to adapt. There is no avoiding climate change. It is here. It is here to stay. So we need to adapt to those changes that happen. But both are absolutely critical. And I just wanted to demonstrate that by this graph here. So you can see where the little today is, around about 2020 there. So in terms of what our future looks like, all of those different colour graphs are different options around what our future will look like. We want to try and keep it to the little red circle where the Paris agreements are, which is a 1.5 to 2 degree increase. But at the moment, we're not tracking to meet that target. We're really tracking to this mid-level emission. So in terms of where we end up, it absolutely depends on the actions and decisions that happen today. And on the next graph or the next slide, I just wanted to demonstrate why those decisions are so important. So even if we're looking at a 0.5 degree increase, if some people will say, well, 0.5 degree, it's not much, such a small number. But if you have a look at that little infographic there, the difference between 1.5 and 2 degrees is significant. Okay, at the moment we're experiencing temperatures of about a 1 or slightly over 1 degree increase, and those impacts are quite significant. So limiting the temperature is really important. And if we think about the lines on the graph that where we want to avoid the very high emissions and the high emissions, we have to recognise there are limits to our adaptation. We may simply not be able to adapt to those. So it's really important that we mitigate greenhouse gases. In terms of health, mitigating greenhouse gases is it's a no-brainer. I mean, if we're moving from burning fossil fuels to renewable energies, the improvements in air quality are really astronomical. Moving to things like a more plant-based diet to reduce agricultural emissions is a health benefit. Moving to more sustainable transport, getting out of cars, onto trains, onto bicycles is very good for our health. And things like creation of urban forests is also very good for our health. Whether or not these things are happening is another question. But in terms of the health benefits, it's very, very clear that we should be doing these things. So these are just a couple of pictures about how people are being spurred into action, about how the future of our children, the future of us, the future of everyone on the planet depends on these decisions, and it depends on people getting out there and trying to make a difference. So hopefully I've demonstrated why our health very much does rest in the hands of climate change action. We are, and sometimes we forget this, absolutely dependent on the services provided by Earth, air, water, food, etc. And these are at risk from climate change. So what we determine, what we do will determine the health of the planet, the ecosystems, and all living creatures. Obviously, I've focused on humans, but all living creatures. So it's really important that we increase pressure on government and institutions to make the choice of strong climate action a political imperative. It's certainly a moral imperative and an environmental imperative, but sometimes that's actually not enough for politicians. We need to make it a political imperative. Obviously, we can make our own decisions and change our own behaviours, but we really need that change at a system level. It needs to go to policies, etc. So in wrapping up, every action certainly matters. There is no silver bullet. Every bit of warming matters, every year matters, and every choice matters. And as demonstrated by this young woman here, our future is in your hands. And I think really that's the hands of everyone, ourselves as individuals, but also as communities and governments around the world. So thank you very much.
Helen, that was very sobering and very well described, taking us through that journey. And I know that when you see how it impacts people in Laos in particular, you know, with that image of that poor little boy stood in that drought-stricken riverbed, and then you couple it with it hits everybody, because we've got in Australia, we've got our problems too. It just brings it home that, you know, we are all impacted by this from the health point of view. Did anybody have any particular questions that they would like to ask Helen? Any burning things? Just take yourself off mute to do so. If it's any consolation, Helen, we are trying to do things in WA on adaptation now. The Department of Water and Environmental Regulation released a report on risk assessment and climate for government agencies last week. So we've been working to try and get that sort of rolling. So it's not actually in the public domain, but there's stuff happening within government, which is
great. Yeah, I did just want to say, when you said it's kind of a sobering picture, and I mean, it's a bit of an occupational hazard when you work in the area. And I did mean to add a thing at the end, which is, I mean, we've still, it's such a fine line when you're delivering the message, because we still have to have hope that we can do something. I mean, giving up, saying there's nothing we can do is absolutely the worst thing. I mean, I don't have a crystal ball. I don't know where we're going to end up, but I certainly do know that if we do nothing, we're in really big strife.
Well, if we do nothing, we're making action. By taking no action is an action.
Yeah.
Vicky, your hand is up. Did you have something that you'd like to say?
Vicky Naser. Oh, right.
Yeah.
Vicky Carmen Brown, sorry.
Thank you very much, Helen. I really enjoyed your presentation. And I was wondering, do you allow others to run your PowerPoint? Do you have a way that we can access that PowerPoint, or do you want that to happen? Because I'm thinking there would be some groups that I know that would probably benefit from seeing this.
I'm more than happy to share the presentation, or for someone to hit play on the recording. I'm more than happy, or to come and do it in person if I've got the time. So yeah, certainly.
That's wonderful. Thank you very, very much.
You're welcome.
Tyrrell, you had a question.
Can you hear me?
Yes, we can.
Yes.
Okay. My question is, Helen, I think that those graphs that you showed as a mathematician, I found fascinating. And I think they very clearly describe the longitudinal impact of not doing anything. And we really do need to get that out. And I sincerely thank you. And if we could please get our politicians, if every Zontian sitting here at the moment could get a copy of that and show it to everybody who's going to be standing as a candidate in the potential election that we're going to have in Australia in 2022, because we have to ram home the impact. It's frightening, absolutely frightening. So thank you very much.
Thanks, Tyrrell. I mean, I just add to that, I think one of the things I didn't say, but I should have in the talk, was you might have noticed in the graph but really we're at the beginning of the differences that different pathways will make. So there is going to be an exponential, well, there might not be an exponential change. It depends what emissions pathway we end up on. But what will happen in the next 10 years is already decided. And this is the thing. There's been images of, I think Carol used a freight train. I mean, it's not just like, oh, I've all of a sudden decided that climate change is an issue. Let's stop emitting greenhouse gases. Well, that would be great, but it's not going to be for another 10 or 15 years until we realise that. So this is actually a really, I think, a really big issue in terms of how humans work. Something like COVID, for example, that has, you know, flipped the world on its head and resulted in huge amount of actions. It's very, we do something and there's an effect. We're not very good at thinking about, you know, 20, 30, 40 years down the track. Yeah, and that's why I really try and, but it's also, you have to be careful of showing that graph of teaming it with what is happening now, because the minute you start talking about exclusively the future, and particularly the year 2100 is used a lot, people go, oh, 2100, it's miles away. So we have to, it's a tricky communication thing. It's about now, but it's also about the future, if that makes sense.
Yeah, absolutely.
Bernadine, you have your hand raised. What would you like to say? You're on mute, Bernadine, sorry.
Helen, that was excellent, thank you, and so easy to follow and comprehend. And just following on from what Tyrrell said, I know by showing it to the politicians, I'm sceptical in that area because I don't think they're listening and they don't want to hear. They've got their own agendas. I really think this needs to go out into the community, into the people, because it's a groundswell of people speaking and saying this is the direction we need to go in. So I would like to say, follow on from what Vicky said, is if there was a way we could get a copy of it just to explain to people, because I think we all see climate change, but we don't understand really the impacts that are out there. And I mean, that picture of Manly Beach is one of my local beaches, and I can say it was so true, and it happened for about 3 months of all of summer basically, that you couldn't walk out the door without gagging. That was pre-masks, so that was before COVID. And I know friends who have asthma who really struggled with those conditions. So only small pockets of the community are actually experiencing it or understanding what climate change is. So I think your presentation has really put it in a nutshell, saying this is what we're going to look forward to, because we don't get that information otherwise. So thank you very much, Helen.
Thanks very much, Bernadine. Yeah, I mean, in terms of the fires, I think the figures were that there were about 35 direct deaths from the fires. Obviously, people who, you know, couldn't get away quickly enough. But the estimate is there were about 400 deaths from a combination of exposure to the pollutants and also the heat.
Yeah.
And I guess this comes back to the silent aspects of it. We don't always hear those statistics. But in terms of, I guess going out into the community, I guess the thing is that politicians always act in a way, they're always open to some form of external pressure. And so it might be lobby groups, it might be from their own political party. I think we get to them by the community, but the community has to become a bigger and bigger and bigger and bigger external pressure. Yep. As I said, so it becomes a political imperative for them to do something about it. I mean, and it's frustrating because the science is there. And the science has been used relatively effectively with COVID, but I think there's a blind spot with climate change.
It's interesting, Helen, they always say that you get the government that you deserve, but I read about this thing the other week called Overton's window, and it was saying is the level of comfort that politicians have about talking about a particular area. And so if they're talking to people who say, oh, you know, climate change is going to take my job away, they won't talk about climate change or put it on their agenda because they think they might lose votes. But if they're talking to people that say, I just need you to talk about climate change in an adult way in Parliament because it's so important, and if everybody that they speak to is saying that, then it boosts their confidence to actually talk about it. And in Australia, it's just got so toxic that the politicians, I feel for them actually, because they're there to get voted in at the end of the day. And they're just so frightened of speaking out in this area because we go down their throats when they do, or some do, you know. But,
yeah, I mean, the position of Australia is, well, I find it embarrassing.
yeah.
So I'll be working in, I'm doing some work in Laos at the moment, helping them with their health national adaptation plan around climate change. And they'll say things to me like, oh, well, it'd be good if you could use, you know, your experience, your knowledge of the Australian health national adaptation plan. I said, we haven't got one. So I really, sometimes I think living in Australia, we don't realise how far behind we really are in terms of action on climate change.
Well, Helen, thank you again for that fantastic talk, and a round of applause. It was just brilliant. Hit the spot,
Everyone.
and I think we'll all
Thanks,
want to
Carol.
hear more, which is great.